Hello, and welcome back to another episode of Guidepost in Motion, a podcast highlighting risk, compliance, and security professionals with insights meant to keep you, your business, and operations moving forward. My name is Bradley Dizik, and I am a Senior Managing Director at Guidepost Solutions. I'm excited to welcome back Dr. Mary O'Connor for part 2 of our podcast, Launching a Virtual Startup from a Compliance Perspective. Mary is the co-founder, Chief Medical Officer, and Chief Compliance Officer at the healthcare startup Vori Health, which opens its doors earlier this year. Vori Health is an all-inclusive medical and healthcare provider practicing a holistic, integrated approach, starting with musculoskeletal care. The organization offers full-service physical medicine and rehabilitation care in a virtual setting. Mary, thanks for being here.
Brad, I'm happy to join you again today. Thanks for having me.
Absolutely. Mary, in our last podcast, we talked about hiring a compliance consultant prior to launching your startup and the challenges of building a compliance and ethics program for a virtual, regulated business such as Vori Health. We also touched upon conducting good due diligence in the hiring process. We talked about establishing a code of ethical conduct, a culture, values, things that really define what and who your business is, and who it's going to be over time. With today's discussion, I would like to talk about the privacy challenges with utilizing work from home employees for a heavily regulated business. Mary, can you talk a little bit about how Vori approaches privacy? When you think about privacy, you usually think about it in terms of brick and mortar. You're visiting the doctor's office. You go into one of the rooms. You meet with your doctor. And you tell your doctor, what's going on with you, and you have some insurances and some control, over your privacy. In a virtual setting, that's very different. You're not within the confines of brick and mortar. Some of your information may be held in a cloud. Can you talk about, the values of Vori, how it considers privacy, and then, how it approaches building controls around privacy and some folks, most important and vital information?
So, Brad, that's a really great question. And yes, it is a very heavily regulated industry, as you know. And that's because it's really important that we respect people's personal data. So we take privacy very seriously at Vori. And we approached privacy as we've approached other areas of, compliance, with having strong policies, good procedures, and then creating controls to basically audit our performance. We see the virtual setting as a setting where having the right tech solutions and programs in place to be vitally important, right? It's very different in the virtual setting, just like the example that you gave. If you're seeing your doctor face to face, the door is closed, it's the two of you. If you're seeing your doctor virtually, and that interaction is happening through some type of video link, then is your information safe? So this is where I believe that, again, this multidisciplinary team approach, just as we're doing with Vori Health in terms of providing medical care to patients, is very important and equally important when we're creating solutions and approaches towards compliance issues like privacy. So we do this by having the clinical input, which is me, the tech input, which is our Chief Technology Officer, Shri Murtha, who's a fabulous tech leader. And then, of course, more operations people, right? Because how are we going to create that experience for the patient where they're engaged with us virtually, and we know that we are compliant with our privacy policy, and that the data that we obtain is secure in that virtual environment. And that's really where there's a lot of work that we've done and resources that we've invested basically to make sure that the platform is secure and that the data that we collect is secure.
Very, very interesting, Mary. And can you talk a little bit about, we talked in the last podcast about how Vori, at a very early stage, before it even launched, put in place a compliance and ethics program. And that compliance and ethics program includes policies and procedures and practices. And as the Chief Compliance Officer, one of the things that you're responsible for is putting in place a practice that can coordinate the work of all the various people that you just discussed, your operational team, your CISO, your chief information security officer, the chief privacy officer, if the CEO needs to get involved in making decision. Can you talk a little bit about your practices for coordinating all these different functions, and also to the extent that you need to help support them, what your practices are to provide support?
Brad, that's a great question. And, in a startup, oftentimes one person may wear multiple hats. And I'm very fortunate that I had a lot of compliance experience at Mayo in my role there with the Office of Integrity and Compliance, so that I am able to serve right now as our initial chief compliance officer. And I fully expect as we grow that will change. But, as I said, in a startup, sometimes you have to wear several hats. In some ways, that's been fortuitous in our startup mode, because when we're approaching an issue or creating a process, I am much more attuned to compliance issues and risk than I will just say, in my opinion, the average chief medical officer. So if there was a startup where the chief medical officer really doesn't have that much compliance background, I think it's so important that there is somebody who has compliance experience at the table when concepts and processes are being discussed and created, because that then leads to the creation of policy, right? We decide that we need to do something in healthcare, so we want to have a policy that surrounds it so that we document our approach. And then that leads to a procedure. All right, how are we actually going to operationalize this policy? And then, of course, controls that are subsequently built so that we can monitor how we're doing. So my point is, not anyone can be an expert in all things. And really having that kind of multidisciplinary approach where you're having clinical folks, people experienced with compliance, operational folks, and tech folks all together to create the program that works best for your company. I think that will go a long way towards being a great program that is done in the most efficient manner.
So Mary, I think that's fascinating when you talk about, coordination and support and all these different functions that ultimately make up your internal control environment. But more granularly, when we think of an internal control environment, we think about policies, we think about procedures, and working with Vori to set up its policies and procedures. One of the approaches we took, through your guidance was to express Vori's values through its policy and procedures, particularly the ones that are patients facing. So being a virtual healthcare provider, patient-facing policies that the patient is going to interact with are things like terms of use, terms of service, website privacy policy, various cookies. Can you talk a little bit about the role these policy procedures play, not only in your business, but in how you communicate and relate with your patients on a values-based level?
Yes, that's a great question. And certainly we're required, of course, to have a privacy policy in terms of use. But what's important about those documents is the opportunity to share with patients, just as you said, our values. I'll give you an example. We need an email address if you're going to interact with us, so we can get you registered and you can get access to our virtual services. Well, we are not going to take your email address and share that with anyone, right? That is part of your personal information. And we want our patients to know that we protect that and that we respect their privacy and that we're going to do everything that we can to maintain their protected health information as protected and private. So again, it's there's a lot of opportunity to try and share that messaging in many ways. And one way is to use actually tools of compliance to share the messaging of your values. And that's the point that you're making that I want to emphasize, is that compliance work should be a reflection of your vision and mission, not just something that you're doing because you have to do it.
And that's a great point. Doing it because it's something of your values, your mission. It's an extension of all that, and not just because it's a added cost, but because it's a driver of business. It helps people build confidence and trust that interacting and doing business with Vori or any other company is going to provide them value. And in the healthcare space, a sense of comfort and healing. Even more generally in terms of comfort, one piece of compliance and ethics program, particularly in the healthcare space and the virtual space, is information security. And, as we mentioned earlier, Mary, Vori has a chief information security officer. That person is primarily responsible for the information security policies, the information security policies that are required by HIPAA specifically. But as the chief ethics and compliance officer, you have a role and a responsibility to make sure those things are being followed and that they're being effectively carried out. Can you talk a little bit about how you approach managing that risk, particularly when you don't necessarily own the specific policy and procedure as the chief compliance officer?
So that's another great question, Brad, and that's where teamwork comes in, because the chief information security officer and I have a great relationship. We work together all the time. He also wears, two hats. So if there were a situation that were to come up, then basically he would reach out to me. And this is also part of how we created our policy, right? So we have this all written down as to how we want to handle an incident should it occur. Now, fortunately, we haven't had anything, but it's not realistic to think that we will continue to go on and never have, a concern arise. And so that's another, I think, really important point about doing this work up front. Don't do the work when the crisis is happening, right? That is not the time to figure out the best approach. The time to figure out how you want to handle it is when you're not in the crisis.
Mary, I think that's a great point. And, thinking about, preventative measures rather than reactionary or responsive measures, what would you do to give advice to any entrepreneurs who are listening, who are thinking about, creating a startup or may even have a business that's ongoing, but may be in need of, compliance and ethics program or various pieces of one?
Brad, another great question. I think I would have the following thoughts to share with them. The first is, don't view compliance as just something you have to do. View compliance as the opportunity to help drive and influence your culture and all aspects of your business. The second is just invest in the work early. It will pay off for you. You will be more efficient. It will cost you less in terms of time and expense if you do it up front early than if you wait until you have an acute event and then you're scrambling and you're very reactive. And the third is see compliance as part of what you're all about, because compliance is a way for people to know, in my opinion, that you have the right values and that you understand that there are guardrails that any business needs to stay within. And compliance is not, to me, has never been a negative word, although some people see it that way. I really see it as an opportunity to really drive culture and values in your organization and use compliance to support your vision and mission. And that's really how I try to frame it. The last point I'll make is always understand that compliance is like a living document, constantly needing reviewed and refreshed. Because as your business grows, you will find that there will be new situations that arise where you need to review or edit policy or update policy because times have changed. And so I really see compliance as not a stagnant process, but a very vibrant process.
That's fascinating. It sounds like, and in a good way, that Vori and you in particular, Mary, are a very proactive person, value compliance and ethics and use it as an extension, as a value add rather than as a cost. Can you talk a little bit about, when Vori is thinking about doing a risk assessment? I know you guys are talking about, conducting audits around SOC 2 and high trust, and maybe even a broader risk assessment of your culture and compliance program generally. Can you talk a little bit about that?
So I love risk assessments, Brad. I think they are so much fun because really it's such an intellectual exercise to say, okay, how are we going to balance risk? No one can work in a risk-free environment. Life is not risk-free, okay? And so those risk assessments I always find very interesting and I enjoy, and we'll be looking to do that not right away, but in the near future. And as you mentioned, we're actively engaged in working towards, SOC 2 and high trust, which are also important measures to really share with our patients and our partners our commitment to the level of security that we want to have.
Very interesting. And if you had to do it all over again, would you engage a compliance consultant prior to launching?
Absolutely, Brad. I would engage a compliance consultant prior to launching. I would, if I was doing it all again, I actually would have focused on us doing more work up front. We focused, as you recall, on kind of, okay, let's take some basic compliance work that we need to do and get our policies and procedures in place so that we can then develop controls. And I actually, if I was doing it again, I would have expanded it to go a little bit deeper on some other areas up front, because now it is just more and more challenging as we're busier and busier growing the business and taking care of patients to get back to some of that fundamental infrastructure work.
Fascinating. And Mary, I think our listening audience would agree when I say this. This has been a fantastic conversation. The amount of information that you were able to share with us today is invaluable. So Mary O'Connor, co-founder, chief medical officer, and chief compliance officer of Vori Health, thank you for joining us and sharing your insights. Thanks to our listening audience for tuning in. This has been tremendous. If you need help developing or enhancing your compliance and ethics program, or building one from scratch like Vori Health did, please visit our website at guidepostsolutions.com. My name is Bradley Dizik, Senior Managing Director at Guidepost Solutions. Until next time, we thank you again for joining us. Be well.